So people think it's kind of like a flex. I've not been to the dentist.
Exactly.
It's not the flex you think it is, by the way.
Yes.
So
Tetracycline used to mess up teeth.
It still does.
it's normal for old people to lose their teeth whenever they are old. It's not normal. Yes, it shouldn't be normal.
That brings us to those that do whitening at the beauty spas. That brings us to, because they don't know those things which she just mentioned. Like there's some things you need to look for. Yeah, there's something to look out on and to look out for to know if this person is eligible for whitening. I want to do whitening. Sit down.
It's even a package. It comes with nails, eyelashes, and whitening.
And whitening.
How do you even open your mouth?
You want to whiten.
Yeah.
Welcome to another episode of Smile Stories, where we talk about everything dental, health, hygiene, stees for the teeth. And because he's already reacting, we have Dr. Kosi with me, we have Dr. Diola, and we have DSA Toba. Toba, tell us what DSA is, because it sounds like DSS, EFCC, General Chairman amongst the...
So DSA means dental surgeon assistant.
Wow.
So I assist the dentist in the clinic.
But you don't give anesthetics.
If case be for pediatrics,
Can damn somebody.
I can.
Dr. Diola, welcome again to
Thank
another
you.
episode of Smile Stories.
Thank
I'm
you.
still jealous in your teeth. I don't like smiling so much because I have window here, window there. It's not the same thing, but you will fix me one day.
Lide, did you get into fights when you were young? I was a law-abiding, peaceful child.
You know that me, I'm a stubborn somebody. They removed this one in Mushin. This one was Adeniyi Adele. This one was Surulere. If I remember correctly, I'm only joking. Kosi, are we going to hear your voice today?
I mean, I'm here already, so I might as well talk.
Make I speak. Sorosoke.
I'm here already, so so I might as well. Yeah.
I like making him smile a lot because he hardly smiles, and this is what we're talking about. You know, when you have the kind of dentition that you like, you can't stop smiling. Because when you see, I'm jealous, Dr. Jealous.
Follow come.
Let me now remove two on this side and give you one on that side. So we try to talk about the stories now. This one came out from an extraction. But let me tell you the kind of experiences I've had from teeth extractions. We're talking smile stories here. So when I was younger, I never understood the reason why you would take care of teeth and not let them decay. Listen to me.
Right.
Do you understand?
Yeah.
I used to wait till I had cavity before I felt I needed to go to the dentist, right? So I'd been managing my gray lines and everything. I didn't know that was all it meant, that you should get checked. And my parents, as educated and enlightened as they were, weren't the type that would say, oh, we're going to get checks every 6 months or whatever. So one day I was eating something as sweet as, I think it was like fried rice. And I took a toothpick. I had a cavity. I thought it was a grain of rice. It was an exposed nerve.
Oh, wow.
When I took it, Dr. Diola, you know in cartoon when they're doing the animated things, when Tom and Jerry hit their heads and it goes,
Wow, that would be rough.
the thing was now like boom, boom, boom,
Yes.
boom, boom. And then they recommended Indosit. And people always say, Ogweku.
Yes.
But you know it's not. Well, tell us Indosit first before I complete the story.
So it's an analgesic,
okay.
a very potent one.
What is analgesic for the
Painkiller.
Okay.
That's what we call it,
What you use-
painkiller.
Painkiller. Yes.
That's what it is.
That's all.
I don't know why people just always
So
assume.
if you place it on the nerve,
Yes.
direct,
Yes. Oh, I
it
don't
will
even
give you
think I put
relief.
it as. So I took Indosit. It was the one thing that would work with Bonjela. Never used to work for me, but I'm not trying to mention names. I'm just saying what works and what doesn't work. So we got the extraction, and my auntie, who's the dentist, said, we could save these teeth. You don't always have to come to me when it comes to the point of extraction. So tell me what you know about saving teeth, please. Dr. Kosi, I told you I was going to
Yeah,
stop
clearly
you.
a setup, Shabot. So extraction, that is like one particular thing that many people are afraid of whenever they have to see a dentist, really. And it's usually like the last choice. And we are not even happy to tell patients that, you have to do this.
Yeah.
So most times patients either don't want to do other treatments because they feel like it's too expensive and they think it's just teeth. So why bother? But yeah, there are definitely other ways. Even as a child, as you were a child, there are children that we do lots of treatments for, call them pulp therapies, especially when they start to have pain with the nerve like you did.
Yes.
So yeah, That's
Extraction is the last resort.
Yes, last.
Ideally, you wouldn't want anyone to have a tooth extracted.
Except Dr. Oliver.
You like to take your teeth out. He
Our
loves it.
resident extract.
He's,
We find joy in that.
You know, in Baltic
horsepower.
I
He uses
see.
from
That
the
must be what it
southeast.
is. So does why is Kosi reacting? Does scraping and polishing help prevent you needing to extract a tooth or two?
I'm sorry, why am I?
I'm facing you. I need to get you
Okay.
to relax, and then I'm gonna move this way.
So
You're gonna talk to me
You will
whether
do
you
your
like it.
scaling and polishing if you want to
Yes.
keep your teeth. I think in the last episode we talked about how grown men tend to have halitosis and stuff. You know,
Yes.
there's something we call periodontal disease, where basically the structures surrounding your teeth become infected and weak. You tend to get pain. So people think it's kind of like a flex. I've not been to the dentist.
Exactly.
It's not the flex you think it is, by the way.
Yes.
So
No.
yes,
No
so
steez.
let's say that you somehow manage to not eat sugars and you don't have a cavity, and you know you have your teeth, you don't fracture it. Periodontal disease is one thing that I'm very certain always creeps up in old age, especially with men, and it's like, okay, fine, it's time for you to go and visit the dentist. So even when patients come, then they're like very reluctant to have treatment done, especially when you tell them that their teeth are going to be pulled. But I have a favorite saying to patients. I'm sorry if it comes off as insensitive. I'm like, you might not be ready, but when the teeth is ready, you come back and you do your treatment.
You bring yourself.
You know, first time maybe I was saying this.
Please remove this thing. Please remove this thing.
Last.
You will still come here.
So
Yes,
based on your
eventually.
Take your
question,
time.
if you do scaling and polishing, you won't have the things that eventually lead up to periodontal disease for you to have your teeth extracted. So yes.
Thank you for that.
And also, if you listen to your wife.
Yes.
Yes.
When she
Yes,
says
actually,
Yeah, men don't
yes.
listen to their wives
When they
it
advise
comes.
such.
Yes, in fact, we've had
oh, daddy, wa.
I've had wives call me,
That I've been trying
force
get
him
that
to
idea.
come, say something, scare him so that he will come.
Tell him he's connected to
I'm
his
dying
house
in this marriage.
from this smell.
Halitosis, yes.
Oh, daddy, wa. They say you should help us not catch esophagus, please. Help us not catch esophagus.
So, yeah.
Yes, Toba. I wanted to ask you, when they talk about scraping and polishing,
Scaling and polishing.
scaling and polishing.
Thank you. We don't scrape.
I see it as scraping. That's
don't
why I said
scrape,
it like
please.
that. Forgive me. The reason why I said it is that's how I really see it, because most people say you tend to take off a layer of the tooth, exposing, as in taking off the enamel. That's how we see it. The scraping and polishing, you have commoted one layer. By the time I do it like 3 times in my life, what is left is nerve. That's how I feel.
Interesting.
Why are you shocked? I'm just telling you, if you don't see me, it's not just about the money, it's the fact that
Like there is the money.
the teeth is reducing.
Like the Oyen is the
Alaji
money.
said he's coming to fix everything that I have as a problem.
Alaji, hurry
Alaji
up.
But
should come fast.
seriously, educate us, because I'm not lying. I always take it that they're taking a layer off and eventually they're going to expose me to a lot of sensitivity.
Okay, so
School us.
there are, the plaques, when plaques build up and it starts to calculus, it feels so smooth in your mouth because you've been used to it. I mean, you're used to it already. Your
Yeah.
tongue, the oral environment is used to it. So immediately there's a procedure done and you take out the stuff, you feel different. I mean, that's what they probably refer to, that they feel the teeth is scraped or they have some
Yes,
cavity.
it's
Meanwhile, it's just like
scraping and
it's just that what you're used to was taken out, which are the dirty and the plaques. I mean, we take out of
Yeah.
big mouth. So
Yeah.
most times there's no any
Dangers
danger
to it.
to it. We don't really do what we call
So I should teach
scraping.
people that it's not scraping up, it's scaling
Please.
and polishing. It's not
polishing.
scraping.
Yeah.
Now, does it necessarily make the teeth whiter? Because people assume, there's teeth whitening. I get that. But there's some people that are born into this world with teeth that are like a corn of a price of corn. A price of corn, yellow to the core. That's with scraping down. Sorry, not scraping, scaling and
Scaling.
polishing. Does it change?
So there's brown,
Colour.
there's grey, there's all kinds
Different
of
colours of teeth.
discoloration. Yes.
It's discoloration.
It's discoloration.
Okay.
So for external discoloration that comes from things like diet, so coffee, wine, palm oil, Coke, blood tonics, some kinds of medication, a scale and a polish would remove those stains.
Okay.
Now,
Those are the outward stains.
Outward stains.
Yes.
But the internal stains that are structural, that come with the way the tooth was formed.
From the nerves and from everything.
Scaling and polishing.
She will not do that.
Because you know those teeth that they call, I've forgotten the name they call, all those grayed out teeth. I've forgotten the name. There was an actress that used to have it. And apart from that discoloration of the grayed out, the ones they claim vitamins mess up. Have you ever heard of that?
Tetracycline.
Yes.
stain.
Is it a
Tetracycline
true thing
stain.
or is just a
No,
myth?
it's true.
Tetracycline used to mess up teeth.
It still does.
How often did people have to use it that people had vitamin teeth?
Okay, so tetracycline is a potent antibiotic. When we're growing up, it was what amoxil is now.
Okay.
So it was pretty common. People used it a lot. On a regular. Now, the issue with tetracycline is there's a compound within it that binds to hard structure.
Okay.
So it also binds to bone when it is being formed.
And that was when we used it the most.
Yes, when we're kids. So because our flesh is covering the bone, we can't see the stains on the bone.
Yeah.
But you will see it on the dentition.
And there's nothing that can change it.
There is, but when we get to that, we'll talk about it.
The thing that changes it, does it reverse the effect or it sort of like creates a new dentition altogether?
So let me explain the mechanism.
Okay.
If somebody takes tetracycline now, maybe when your front teeth are forming.
Yes.
And the front teeth form inside the bone. When it has come out, it has finished forming.
Don't finish forming.
Yes. So once it starts erupting, it has finished forming.
Yeah.
So if you take the medication while it is forming in the bone, at the time you take it, it will form a band. If you keep taking it, it will keep adding those bands. So it has a banding horizontal pattern. It has fused chemically to the tooth structure. It's inside you like picnic.
It means it has entered you. There's nothing you can do about it.
Yes. Yes.
That's what happens when you marry. The woman enters you. You cannot escape her. Continue.
How did you get?
No, it's because of Dr. Oliver. We're going to see him soon, so you understand why I'm giving him those bullets.
A scale and a polish would not.
Okay.
Would not. It would just maybe make your teeth feel cleaner and brighter, but it doesn't address the stain.
Okay.
Now, tetracycline stains can sometimes be improved, keyword,
Not 100% cured.
with whitening, chemical whitening, using laser whitening, any one of those whitening techniques.
Those also take off layers of your teeth that make you more sensitive.
If you use it repeatedly, yes.
Okay. So there's structured intervals that it's supposed to be.
Yes. So it doesn't take it off, it weakens them.
Because I have a friend that discovered a whitening toothpaste. And now she thinks it's a lipstick. She uses it almost as frequently as she would a lipstick because she bought the kits from America, found it easy to use by herself. So every time, maybe 10 days time, 2 weeks time, anytime she feels, I'm going to a party, she uses it freely. Is it dangerous?
So it depends on what the mechanism for whitening is.
Okay.
If it is an abrasive, which is what I believe.
You know those ones that they put a cup and then there's a UV light or something.
Light.
That they tell you.
So
is that okay?
No, it's not. For that kind of frequent use. Okay, so this is a medical procedure. It's not for fashion.
And it's not for inside your comfort.
It's not for photo shoots. It's not. Yes.
So when you have scaling and polishing, how often should you have it? Once or twice a year? Is it a 6-month thing? Is it something? What are the intervals?
So it's advised you do scaling and polishing twice a year.
Twice a year.
But for people who smoke, who do who take coffee, sometimes we advise them to do it like maybe 3 times a year.
Okay, I'm going to expose myself for a second now, and I want you to pay attention because I don't mind being an open.
Which one do you do?
I smoke.
Okay.
But look at my teeth, just from your naked eye.
Okay.
Tell me what you would advise that I may need. Can you see? Move like this, doctor.
Yeah. We need to open and see.
Don't just say so that we can spend money. Just by looking at me, naked eye.
So the thing is, I won't be able to do that properly here on the show. So that's why we advise how.
Because I can see tartar build up on people's teeth.
Yes,
Yes.
so that's.
Yes.
Can you see that here?
No, so in the tartar you don't have. But
I don't need scale.
it doesn't mean you don't need
Talk
scaling
about
and
it like
polishing.
this,
It doesn't
like
mean.
this,
You should adjust your glasses.
So it
It's over
doesn't
there.
mean you don't need scaling and polishing.
Okay.
Because sometimes those plaques
Yeah.
don't even stay on the surface. I mean, on the front part where we can see. It's
Okay.
behind the teeth. So
in between.
sometimes when you open your mouth, you would so open the
Oh my God. Oh, and then look at Pali. Because I have some friends that they would smile.
And
I
that
feel
brings
so
us
bad
to
for
when
people.
clients call on the phone and say, I want to do scaling and polishing, how much it is.
You
We need
can't
to
see.
see you.
Yes.
Because sometimes you just look at the mirror. Sometimes people forget to even brush inside their
Yes,
mouth.
on the
Some
inside
people don't
of
even
it.
brush it. Like
They
they don't even have the idea they're supposed to brush. Because I've had someone talk to me about that. I just I am out of the.
And there's
How?
nothing in
Do you brush inside? Hey, I was supposed to brush as
At
really.
this age.
Oh God.
Now, on YouTube videos, I've seen some procedures. I'm sure they left it excessively and it became, whatever, where they needed to scrape, I would call it, and it almost explodes. It got to a point where it seemed as if they were exposing the gums. The gums would bleed, but they needed to just, chip at it almost. You know what I mean?
Dr.
It's
Gigi.
like white cement. Yeah,
Exactly.
It's like the white cement all caked up. at
It's
the
like you
base.
used to
What
look
is
for
the
those kind of
cause?
patients.
No, I think it goes to the village.
Village.
Hey,
Go and
it goes to people that have
hinterland.
never had the
Never.
experience
Yes.
in their life.
Yes.
Okay, let's say that's the case.
Yes.
But I've never had scaling and polishing.
Okay.
But is it a case of those ones that have never really brushed their teeth to get that bad?
Yes.
That is what it is.
Yes.
Expatiate, please, doctor.
Okay. So the white, yellowish, solid particles that we
Yes.
see in the YouTube videos are called calculus. Okay. Now, plaque is the buttery, creamy thing you can scrape off the surfaces if you don't brush after a few days, which we all did when we were younger.
Yes.
My son will go and bath. When he comes out,
There's no brushing.
did you brush your teeth? Oh, I forgot.
Let me
So
go
if
back
I
there.
didn't ask him for 4 days, he has
He may not have
forgotten
touched
for
it
4
for 4
days.
days, yes.
Now, that creamy thing, when it becomes solidified, it becomes calculus.
Okay.
So if those people were not brushing, it keeps the plaque.
It's like dried up
hardening up.
cement.
Exactly.
So as
exactly.
opposed to cement that they will say, don't step on it because you can make a mark on it. This one is dried up.
Yes.
We have to.
So it keeps increasing
Chipping it.
layer
Layer.
after layer.
And it's
after
easier
layer
to even add more when you already have
when
it.
you already have.
It stays on you.
Yes. And they don't notice.
They don't care.
Some even think it's part of growing up.
Uh,
Actually.
You didn't
Some
really,
don't
I don't think they
actually.
don't notice that. Some people, or maybe Nigerians generally, don't really pay attention to their. I mean, they see, when you ask them to do this and tell them because they say for ordinary mouth, for just it.
But
You
when
know,
our
that
grandma-
knowledge,
Washing, they
that's
call it washing teeth.
washing
for washing
teeth.
teeth.
When our grandmas were using chewing sticks and everything, I'm not sure. I don't know. I'm not sure if they ever realized that they had these things that Oyinbo.
no, some of them,
toothpaste
they
has
actually do.
actually do.
They had.
Some of them mentioned that they use blade or fork to
Sharp
yeah,
instruments.
to take
Sharp
anything that is sharp
Yes.
to take it. So
To
they actually
try and
they
flick
see
it
it,
out.
and some of them don't really like it because I've been to and I was on an outreach sometimes, and I saw another woman. She came covering her mouth with a
was a
tissues. I mean, she heard the mirror. I didn't know. So she just sat down. I was like, okay, please open your mouth. When she opened her mouth, I was like, oh God,
Blood of
because
Jesus.
I can't even see her teeth.
It was covered.
covered.
And I said, okay, this is going to take a long time. So I took my time because I saw when she was coming, covering her mouth, and okay. So I took my time. The time I was supposed to use to see like
It was a dental outreach.
outreach,
Yeah.
yes. The time I was supposed to use to
She
see
was the
like
only patient
5
that-
or 3 people.
In fact,
And the time I was supposed to use like 5 or 3 people,
Yes.
I was basically cleaning this woman's teeth. I brought out everything. Then she just brought out mirror. I said, oh, so this woman came prepared. She did like this. She did like this. She started praying. She prayed for almost another 30 minutes. I'm supposed to have
Serious.
seeing
another
another
patient.
patient.
But can you understand how it changes someone's self-esteem if I'm going around with my hand over my
Absolutely.
mouth
She
all
said
the time? and then-
she now said that she can't talk to people that if she has to talk, she has to. I understand when she started praying. Even people around were saying amen on my behalf. I've forgotten that I'm supposed to be seeing her.
You know, one good thing about
Eventually, we just she was so glad she left.
can
She wanted to
imagine.
give me 500 naira. I said, madam, I
Yes,
said, don't worry.
we'll cover what we did for you. Dr. Elsie, you're going to say something.
yeah, one good thing about dentistry that I think is just that aesthetics tends to kind of like take precedence. One people don't realize that in trying to achieve that, let me just say S&P, for instance,
Okay.
they don't realize that in trying to remove all those things that they think is an eyesore,
This is
they
something
are
that you
actually
talk. It's you that knows
it's scaling and polishing, actually.
Please look at them in the house and tell them SMP is not
means
girlfriend.
scaling and
It's
polishing.
S&P, not
S&P.
S&P.
Because when he said it, I was like, who's that? Have I
It
met
means
her?
scaling and polishing, actually. So they focus more really on how their teeth will appear. But the truth is that all that hardened dirt, the calculus, actually has an impact on your gum health. And eventually, you said something about the old people who have these issues.
Yes.
It's seen in our society that it's normal for old people to lose their teeth whenever they are old. It's not normal.
It shouldn't be
Yes,
normal.
it shouldn't
At
be
all.
normal.
not.
So because of the fact that they ignore that deep cleaning, it tends to wear away at their bone, and then eventually the tooth become loose and they fall off.
They fall out.
Yes.
Yeah.
So I think aesthetics actually eventually leads to patients getting functional restoration whenever they come for their cleanings.
Now, could you please, any one of you could chip in, could you please tell us where the buildup of calculus and those things tend to affect the nerves that lead to internal organs being affected, or you've never heard of it? Because I hear a lot about nerves being connected to the heart and how it can, manifest in ways that you wouldn't even know is a teeth that cause this, difficulty.
So let's correct. It's not the nerves.
Okay.
Auntie Laide. It's not the nerves.
We're here to learn.
It's not the nerves. So in that calculus, you have bacteria solidified, trapped, concretized within it. When it dislodges, it can, they call it seeding.
Okay.
So when it dislodges, there's bleeding around the gums.
Yes.
The bacteria gets into the blood. The blood can go into the circulation and then go and seed on heart valves.
That is what
That is the direct connection, mouth,
it's
heart.
a gradual process
Yes.
to the one that is actually
Yes.
life-threatening or
Yes.
something.
And then, they say the mouth is the mirror of the body.
They said the gateway to your body.
So it's all
understand?
connected. I don't know why we just
Dr.
separate.
Diola, you say that the mirror. Some people know they look that mirror at all.
No, they
don't
have
even
to,
care. They don't
because-
break
They have to.
the mirror.
Well,
They do not consider the mirror.
Because you probably had this experience, I know I have. Whenever you see a patient, let's say an elderly patient who has a lot of periodontal disease, you discover that they tend to have a lot of comorbidities.
true.
They are hypertensive, they have diabetes. There's like a lot of like
Yes.
connection. So
Yes.
it's
Okay, very quickly before we round up, what would be the difference? When do you decide, oh, this is whitening and this is scaling and polishing?
No, so scaling and polishing is routine dental treatment.
Okay.
So we also call them hygiene recalls.
Okay.
So that's not
Something that comes up as a prognosis.
no.
It should be a normal way
It's a
of-
normal routine thing. So
Okay.
like your 6 monthly checks.
Okay.
Because when you come for the scale and polish, it's not just the scaling and polishing we're doing. We are looking around to see if anything new has popped up. You quickly nip it in the bud. If there's one small cavity, we quickly fill it. If there's a flare up somewhere, we'll treat it.
the
So-
biannual.
Yes.
Yeah.
Oh, I have patients that we do every 3 months for.
Is it because they have money or because they have a need for it? Dr. Kosi, no look like that now. I mean, if I don't have a need to go to the dentist, why would I need to go every quarter?
Okay, so even the patient knows they need to come every quarter. Okay. Some have a higher predisposition to certain things.
Okay.
Yeah. So whether by reason of their diet, sometimes even for like if someone has heart disease, I wouldn't advise you wait 6 months. Let's clean you more regularly than the average
someone who's
person.
generally.
Yes. Then
Okay. Sorry. No, you were going to say something. I thought
there was
yeah.
a second. How the difference
the
between
difference
whitening.
between whitening when you decide it's only whitening and when you decide it's only scaling and polishing.
So
how do you?
the decision for scaling and polishing is a regular thing.
Yes.
But for whitening, we assess.
Okay.
Not everyone is eligible. So even if you don't have the tetracycline stains,
Yeah.
even if you don't have, we will assess.
Okay.
Because for whitening, laser whitening, chemical whitening, any one of those types of whitening, we are whitening only the top layer called enamel. We are not whitening the
Anything
second
that is
layer.
underneath.
Now, for some people, that top layer is really thin and translucent. Those category of patients will not
exposure
achieve
to
any.
such,
No,
yes.
it's not advised. If you have a lot of cracks in your teeth, we will not advise you to go ahead with whitening
Whitening.
because it will seep through those cracks and go and irritate your nerve. That's why some people complain that they have severe sensitivity after they've done it.
That
Yes,
brings us to
because-
those that do whitening at the beauty
Oh,
yeah,
yeah.
spas.
Thank
That
you.
brings us to because
Our-
they don't know those things which she just mentioned. Like
Yeah.
there are
They
some
don't
things you
know
need to
what
look
the
for.
dangers are.
Yeah, there's something to look out on. To look out for to
Yes.
know if this person is eligible for whitening. I want to do whitening. Sit down. Bleach.
In fact, somebody
Bleach
told
everywhere.
me
to calculate
And it's not supposed to be like
So
that.
now it's even a package. It comes with nails, eyelashes, and whitening.
And whitening.
How do you even open your mouth?
What do you want to whiten?
Yeah. So,
Okay, so we're going to round off here today on that. And we're going to come back soon to another episode of Smile Stories because we're delving deeper into your canals, the roots, and everything. Join us next time. Thanks for coming.